All right, hello everyone. So in this PowerPoint, I'm going to be talking about injuries to tissue. Okay, so injuries to all the tissues, very obviously, but no, they can affect a lot of different things besides just like the skin or the muscle. For example, we also have fascia, cartilage, muscle, tendons, ligaments, veins, and arteries. Okay, they can all be affected from that one injury. Okay, a lot of injuries, very obviously a lot. As you can see, this is degloving. Is all like the skin and fat has been removed. There's going to be a lot of pictures like this in this PowerPoint. All right, so first, a few different things. So an open versus closed wound. So a closed wound is pretty much the skin is not punctured in any way. Versus an open wound, okay, like this compound fracture here, the skin has been broken. Okay, that's very, very important because the open wounds really open up and increase the risk for infection. It's a really kind of big thing. Versus closed wounds, everything's really kind of, besides closed, stuck in there, and there's no option for outside bacteria, for example, to get in. Okay. Abrasions. Okay, abrasion is usually caused by a sliding or skidding on pavement. You'll see it's very kind of superficial. It's not very deep. Usually it's a pretty broad area depending. So this is probably going to need probably really small. Some can get as big as the entire thigh. Like slide tackling is a big one. You usually got to clean it to prevent infection. This is the biggest thing you got. Treatment, okay, soap and water, okay, is your biggest thing on pretty much everything that's going to happen in here. It removes all that kind of dirt and or bacteria if there is some there. First aid cream, okay, which is going to be that antibiotic cream. Okay, you also want to make sure that there's no allergy to that antibiotic because a lot of people do have allergies to some antibiotics, especially if you use the broad spectrum ones. And you want to cover with a non-adherent pad or bandage. So the non-adherent pads are the ones, I don't think I have any in here, are the pads that do not stick. It's going to look like, it's still gauze. It's going to look like the, what's on a Band-Aid, that really kind of shiny, like white area, square usually. That is a non-adherent pad. Okay, you can buy gauze like that. They're about as big as this piece of paper, 3x3, 4x4, 3x4, whatever size you want to get. They're pretty cheap for the most part. And so this type of gauze doesn't absorb a lot of fluids, like a Band-Aid doesn't really absorb a lot of fluids. But it doesn't stick to that injury. So when you take off that Band-Aid, you're not ripping off that scab. Okay, because then you're just kind of restarting that healing process, ripping off that initial scab. So the non-adherent pads, for one, are really good for those injuries that there's not really a lot of bleeding, there's like a little bit, and that it's allowing that wound to heal without really keeping it, backtrack a little bit. When you take off that bandage, you're not ripping off that scab like a normal gauze pad would. Okay. Honestly, with most like wounds, like abrasions, you want to change it roughly every day. Like usually before or after you shower, usually a big one. Watch for signs of infection, which is going to be redness along the outer area. Now, I've never really seen the blood poisoning from wound that's usually just the wound that was never treated properly at all. But usually to prevent that kind of infection, you really want to keep an eye about this redness that stays on the outside. If it starts to get bigger, the redness starts to extend out a bigger area, then definitely you want to get that checked out because that's really that infection spreading at this point. Most of the time you're not going to have this because your body is really resilient against a good amount of infections. But normally it can get a little red on the outside, probably not to this extent. This is probably photoshopped to see a little bit better. But you really make sure that that wound is not getting super infected. All right, lacerations. Lacerations are a result of like a tearing motion. Okay, you're going to have some like jagged edges. Okay, not an incision. I'll talk about incision here in a little bit. Okay, these can be minor and or deep. Okay, you got to really keep an eye out for what else could be damaged with this. Okay, so you could have nerve, blood vessel, muscle, tendon, ligament, or bone damage as a result. Because you're only seeing what you see. You can't it's very hard to distinguish the underlying structures. Okay, so this is, I'm going to guess, a knee. So right across the front. So obviously you can have a lot of other injuries with this. Like if this is a knee, there's a patella tendon, which would be roughly right here. You get meniscus, which is also be damaged because that could roughly be the joint line. You have a bone contusion from this eye-looking thing right on the patella. You don't really know what's the extent. And obviously because this is a full thickness laceration, this just means it goes all the way through all the layers of the skin. So we can see like the subcutaneous fat and connective tissue and muscle and so forth. Is any blood vessels like capillaries that's in here, nerves that's within the skin are going to be torn. Okay, that's just how it happens. Okay, so immediate treatment. Okay, see soap and water. Okay, you don't want to use anything other than really soap or water. Best. I mean, you can also just irrigate it. I'll talk about irrigation, I think, later on in this PowerPoint, but that's just running water through it. Okay, but again, no alcohol, no peroxide, nothing like that. That's actually going to slow down the healing by a considerable amount. Okay. Okay, so keep it clean. Okay, compress it, stop bleeding. Okay, compression is the best thing you can do. For something like this, it's going to need stitches. All right, so anything that inch and a half long is going to require stitches, especially if it's on an area really sensitive like the face. You're going to need stitches, okay, to make sure that you reduce that scar or just reduce it as much as possible. There are areas where like a knee or elbow, it's going to be more of a badge of honor on that, but you still want to make sure that it's sutured shut. That way it heals faster and appropriately. Okay. Then depending on whatever caused that laceration, you might need like a tetanus or booster or something else. Okay. Follow-up, okay, you want to make sure there's no like redness or heat, swelling, red streaks, or kind of drainage as a result of that. Some drainage can be possible with some injuries like this one or that kind of big avulsion right there. So that can be normal, but you got to make sure it's appropriate. It shouldn't smell. Okay, smelling is a sign of infection, so you got to be really careful about that. I've never seen the red streaks. I can't comment too much on that. But for the redness, can make sure that the redness isn't spreading. Okay, so it's going to be around that whatever injury normally, but make sure it's not getting like way up on here for an injury that's down here. Okay. Puncture wounds. Okay, so whatever object is embedded within, you want to make sure, one, that you do not remove it. Okay, keep it where it is. Okay, like it's a nail, for example. Okay, do not take it out. Okay, more injuries can be caused by you taking it out than it going in. Okay, you're probably going to give them to like urgent care or the hospital or whatever. That way they can take it appropriately. Because again, you don't know what's underneath that it's punctured. Okay, given the pinky toe, no one really cares about the pinky toe. Let's say it's a hand. Okay, you taking out this galvanized nail, which a lot of these nails they have, you can see a little bit like of a thread here that just makes sure that stays in the wood better. But a lot of time there's other structures that can be like a rough, like jagged edge that you taking out can cause more damage. Okay, so this obvious like impalement of this nail through this hand. For one, you want to keep it clean, like irrigate it, use some gauze to kind of control bleeding best you can. But you want to pretty much splint it as you found it, okay, and then refer them off to better care. Because like let's say right here, well, there's probably that's going underneath one of the tendons. Okay, hopefully it's not damaging any other tendons. You don't know what else is happening in bone here or like tendon here or even some of the nerves that are on the hand. Okay, so you taking it out can potentially rip or make that injury worse by you just pulling it out however appropriate, so where they're going to know exactly what's going to happen. Because once they get to like let's say the hospital or ER, urgent care, they're taking X-ray, identify, all right, the bone fractured here or there. They may need surgery depending on whatever it is. Okay. So always make sure that you splint it as is. So I would like pack some gauze in between the fingers here, splint the entire hand. Okay. because the fingers, okay, if you look at the screen, okay, everything that controls this goes all the way down to here. Okay, all your fingers originate down here. So if I put my finger right here and I flex, I can feel the motion happening of the muscle contracting here. Because the muscles are only here to there, and then the tendons go all the way down to your fingers. Okay, you do have some muscles in your hand, but the majority of them, especially does all like the bigger like grip strength, all originates down in your forearm. Okay, that's why you really want to mobilize all the way down to here for a puncture wound. It sounds a little extreme, but that's what you want to do to prevent it from getting worse. All right, splinters. Okay, splinters can be usually wood related. They can be glass, they can be metal, a number of different things. Obviously, you don't want to soak them because wood expands, which makes it harder to remove. Okay, don't try and squeeze it to get the internal pressure to kind of pop it out. It doesn't work that way. You want to get like forceps. You want to sanitize the area, which just means is you're going to take some like rubbing alcohol and like sanitize around it, because alcohol is good for sanitizing before this. You want to sanitize like the tweezers. Okay, you're going to pull it out in the direction it went in, okay, if you can get it. And in my experience with tweezers, for one, like I even get like the high-end ones. Some of my tweezers will cost as much as like $20-$30 because I want really nice ones. Is the longer pointy end is not the best one. A lot of times you're going to get like the shorter pointy end, like down here, which is this one right here, because that's usually a little bit stronger than these outer ones. Okay, and I pull that out. And then clean it with soap and water, and then it's go on its way. All right, incisions, okay, different from like a laceration. These are more the clean knife-like cuts, okay? Now these can be very, very deep because usually that knife goes through like butter, okay? Deep, you damage a lot of the muscle, tendon, ligament, vein, arteries, nerves, any of that underlying structures, very, very easily and quick. Usually it's a very kind of clean cut. Okay, as you see, this is surgical, obviously, but it's going to be something like that. Okay, treatment, okay, obviously soap and water, irrigate that thing. You want to try and close it up if possible, if you have like the stuff for it. If not, I mean, obviously you'll get like, I think this is staples right here. This is stitches, and these are steri strips. So steri strips are the modern day butterfly bandages, and that's more to kind of keep it closed after you kind of clean it out. That way it starts to kind of heal a little bit, so it's not like kept open the whole time. And obviously there's obviously not a bleeding to put this on, but if there's still bleeding, obviously your concern isn't to close it up. Okay, if you're all bleeding, your first priority is to control bleeding. Okay, sort of like these on the outside are more like knee replacement incisions, and I couldn't tell you what this one is. There's a result of something. Okay, avulsions. Okay, so an avulsion injury is more like a flap is torn loose. Usually doesn't go very deep, but that whole flap of like skin is just kind of flopped out to the side. So if I was like, I want my shirt, it'd be like flap that whole thing open. Okay. Usually affects a large area or a larger area, but it usually doesn't always have to be very deep. Okay. You want to make sure the area is kind of clean, maybe irrigate it, sterile compression help stop or control the bleeding. Reattach that torn tissue if possible. Like if it's not completely like cut off, but just kind of flopped over, you can just flop it back where it should be. That way, hopefully, you can still save that skin. If it's completely off and it looks like it's pretty clean, you can put it back on there. If not, keep it, moisten it with gauze, put it in a plastic bag, and have it transported to the hospital, and they can probably reattach it then. Okay, depending on like the size and so forth. Okay, all right. Do a little bit lighter area. So calluses. So calluses are a thickened kind of usually painless area of skin. Okay, caused by friction or pressure. Usually the combination of the two. You're going to have mainly on the feet, sometimes on the hands. they can cause some pain, especially when they get like really, really big. Like these are some pretty good ones. Usually they'll happen like here inside the foot, just the areas of just higher friction. Okay. So the first thing you want to do is get rid of the cause of the friction. Okay. And you can file them down, okay, or cut them down. Okay, so this is a callus shaver. You can buy pretty much anywhere. There is a blade on there, and then you just kind of rub it over the area where that callus is. You know, take off only the hard skin. Okay, don't leave the softer skin in there. You don't have to go really hard. It's really kind of quick and easy. You want to do this when the skin is clean and dry. Okay. But under layers can be sensitive, so that's why you want to be careful with some of that. But reducing the cause is the biggest thing. So a lot of times on the feet, I'll have them double sock. That way the socks rub against one another and not the sock on the skin. Make sure the shoes fit appropriately and they're not too big or too small. There are some other bigger things. Maybe change socks often, like say they're a heavy sweater. Maybe like halftime or between quarters or whatever, they just change their socks. That can help just kind of cut down on that friction by taking away that moisture aspect. Blisters, very similar to the calluses, respond to friction. Okay, usually bubbles up. Okay, something like this. Okay, try not to drain them on your own. They'll drain naturally. Okay, don't force them because you're potentially opening it up for infection. Okay, which is not what you want. Okay, so obviously this is a really bad one because it's like everything. You want to try and get them early if possible. You can take them to the appropriate personnel to drain. There's proper ways of draining them, but don't try and just do them on your own. Okay, usually people get a lot of really bad infections this way. Hematomas. Okay, so this is just a blood-filled area. Okay. They're usually closed wounds. Like this kid's a really nasty kind of knot hematoma on his forehead. Usually involves only the soft tissue. Can affect kind of like the muscle, blood vessels, and skin just because of that big condensed area where it puts just kind of pressure and can have some like secondary injuries. The common we'll see is like the little blood blister in your hand. Just leave it alone. It'll drain on its own. Okay. All right, so some things on some treatment. Let's say you put ice on it. So ice is really good to reduce like inflammation a little bit and kind of slow down the metabolism. Maybe make sure that that swelling isn't like so out of control as this kid. Okay, so rice is rest, ice compression, elevation. Okay, you could have direct direct contact of that ice on your skin for 20 minutes max. Okay, within that hour. Okay, so you want to take about the rest of that hour off in between. You don't want to over ice because that way you're just lowering the metabolism so low that not a lot of healing is occurring. So we want to be careful on that. Okay, so you're going to repeat usually every hour. Okay, there is a difference between a chemical pack and a wet ice pack. So the wet ice pack is just ice in a bag. That's it. Okay, or peas or whatever. But a chemical pack actually uses as a chemical reaction that to make that pack cold. Okay, it doesn't require ice. It can be really effective. Costs usually a little bit more. You gotta be careful because chemical packs do get colder than ice, okay, especially colder than these like wet ice packs. So you can't have them directly on the skin. You'll actually kind of freeze off that top layer of skin, okay, or give yourself pretty much like a secondary degree burn in some cases. Okay, so that's why you want to put the best one. Also, I'll put the chemical pack inside a pillowcase, just thin enough that we can still feel that ice really good, but you're not going to burn off through the top layer of skin. And you can make your own chemical packs on your own. They're really cheap. All you need is a gallon bag, and it's 1 part rubbing alcohol, 3 parts water. That's it, 1 to 3. Okay, put it in your freezer for a few hours, and it comes out looking like a slushie. It's reusable. It's pretty cheap. Just make sure you do not put it directly on the skin. And also, if you're going to ice on the skin, make sure you're not icing directly over that, like really sensitive, like maybe it's a slightly like abrasion. Maybe put a layer in between, Because if you're icing an abrasion, you're going to freeze those already damaged ends that are trying to heal. So you don't want to like get it like super cold or put it directly on there. Okay. Also, rest, just break down the rice a little bit. So rest obviously is important because more activity will make the injury worse. Ice to lower metabolism, help with pain management. Compression is good only if they have a lot of swelling. Like not everyone's going to have this crazy big hematoma anywhere after impact. So it doesn't always mean that you have to do a lot of compression and elevation. Now, if they have a really kind of big ankle, for example, that you can't even see the bones or much where the knee ends and the ankle begins kind of swelling, then yeah, that's where the compression and elevation is really, really key. Okay, so especially for like lower extremity wise, I'll have them like ankle. Lay on the ground, put your leg up against the wall, okay, a compression over the ice, okay, and have them like wiggle their toes to try and use gravity to get all of that kind of extra fluids to kind of drain back towards the core of the body. Okay. Contusions, okay, so contusion is a soft tissue injury, usually results in a bruise, okay, and you see this ecchymosis here, that discoloration in the skin, okay, usually caused by dramatic blow to the body. Severity obviously depends on the amount of like pressure applied, the force, etc., just the extent of the injury. Gravity plays a big role on this ecchymosis aspect. For example, this is probably an ankle injury from this picture, where the gravity has brought all that ecchymosis and extra blood down to the foot. That's why it's really important to like elevate, because that way you don't have like sausage toes. Not really attractive. So for contusion, there's mild, moderate, and severe. So mild contusion, point tender, local pain at the site of injury, pretty much normal range of motion. Okay, the moderate contusion, swelling, point tenderness, the pain of the site, can have some decreased range of motion, ROM, and the patient may walk with some type of abnormal gait. So abnormal gait is like limp, for example. On severe contusions, tenderness and swelling over and around the injured site will cause a severe decrease in range of motion, usually unable to walk or without a limp. Okay, so these are really, really bad ones. Okay, obviously rice is good. The bigger areas, you should ice on a stretch, especially like the bigger like muscle areas like quad, bicep, tricep, for example. That way, on a stretch, not an intense stretch, just you're trying to elongate that muscle. That way, it doesn't allow for blood to stay in that area. Okay. Ice 20 minutes. Range of motion exercises. Try and get like that contusion back to normal. The bad ones, you want to measure for girth. It's just around the extremity. You kind of compare it day by day to make sure that it's not getting worse, or for documentation reasons. Follow-up treatment, okay. Try to have some kind of treatment schedule, mild stretching and range of motion exercises to try and get it back to normal functionality. You can pat it to try and distribute the forces away, especially if there's a high chance of a repeated blow, like football, for example. Football and quad contusions are usually a pretty high amount. All right, wound control. So you want to control that hemorrhage. Okay, for pretty much wound control is your biggest thing. So hemorrhage is just bleeding. That's a fancy word for bleeding. Okay, usually it's a lot of bleeding. Okay, so for one, you want to look at the type of blood. Okay, so venous blood is dark red with pretty much a continuous flow. Capillary blood is that reddish color. Okay, and then arterial blood is bright red and it just spurts out. Okay, just know that. Usually under higher pressure, hence the spurting. The spurting is pretty much every time your heart beats. The heartbeat, spurt. Really key to identify, because the arterial bleeds is the ones that are going to bleed a lot. Really crazy. Okay, I mean, you can still bleed a lot with these the venous blood. The capillary blood is not going to be really crazy because capillaries are really small. But the arterial bleeds, where each heartbeat you're going to lose a lot of blood. Okay, and so control for all of these, the best one is going to be direct pressure. Okay, I'm going to talk about elevation and the pressure points, which we were previously taught a while ago. But direct pressure is going to be the golden standard for this. Okay, so direct pressure is the first thing done for hemorrhage. Okay, so pressure is applied with a gloved hand and some kind of sterile gauze. Okay, firm pressure is applied against resistance of bone. Okay, that's how hard you're pushing. So you want to push that, whatever it is, down against the bone. That's how hard. Okay, so it's pressure in that one spot, not pressure all the way around. Okay, pressure all the way around, now we're getting more of the tourniquet areas, which I'll talk about here in a minute. Okay, so especially with the direct pressure, you're trying to give external force versus that internal pressure. That way, it starts to clot. That coagulation slows the bleeding and so forth. But it may take a while. It's not going to be direct pressure for like, oh, I'm going to hold 30 seconds. This may be like 5 minutes or so. To the point where you want to do a elastic bandage over this to keep that additional pressure in place. And if they bleed through it, you don't take it off. Okay, because then you're going to rip off the scab that's already starting to form. You just add another, excuse me, you're going to add another gauze pad on top of that bandage and then wrap it again. And you keep doing this until the wound stops bleeding. And then you don't even take it off. At that point, if it keeps bleeding out, they're going to need more advanced care than whatever you can provide, like out in the field. So this is where they would maybe go to urgent care or hospital. Because if they're bleeding like that, there's not a lot you can do. They probably need stitches or more advanced help. Okay, elevation actually is not backed by research at all. Kind of old wives' tale. Okay, so the thing was they're going to elevate it above the heart to try and lymphatic drainage, try and reduce the pressure. Well, my blood pressure is like 120/80 with my arm here. If I haven't cut my arm and I raise it above my heart, my pressure in my hand is still 120/80. Okay, so not a lot of pressure has gone down as a result of me elevating it. Okay. In fact, you can make some injuries worse by opening up that hemorrhage more. Okay. Or if there's an underlying fracture, okay, in let's say this kid's arm, elevating it could make this pain and displace that fracture more. Okay. And then the lymphatic drainage is not really your key concern right now because you're trying to stop bleeding. Okay, not get swelling to drain out. Okay, so elevation is just not a thing that we really use anymore. All right, pressure points. So this was pressure points are other ways that we were taught back in the day to slow down, also called indirect pressure. Okay, so for example, I have a cut on my forearm, let's say here, and I'm doing direct pressure and it's not really working. Well, I'm going to put pressure on the artery, okay, up in here or under the bicep to try and slow down bleeding enough to control the bleeding here. Well, again, this is another item that's not backed by any research, period. And has really not been shown to slow down anything for that hemorrhage. The common locations they'll use is the brachial artery, okay, against the humerus, okay, and then the femoral artery, which is in the femoral triangle right up in here in the hip. And the brachial one is just like right in here. It's put a lot of pressure right on the inside. But really, it doesn't do a lot. So, and they always say, well, if that fails, then use a tourniquet. Well, if you have enough pressure on, let's say, a cut here that's not doing anything, just throw a tourniquet on. You're just going to waste time because the pressure point or the indirect pressure is not effective. And then when we talk about internal hemorrhage, okay, so let's say it's not a bleed that comes out of the skin. Okay, they're not hemorrhaging blood out, but then maybe they're hemorrhaging blood in. Okay, for one, it's very, very hard to identify. Okay, because you can't see it. A lot of times you just kind of keep it in the back of your mind, especially the bigger incidents of like auto accidents, equestrian, just the major like bigger items to where you want to think outside the box a little bit. So this is just pretty much on where internal bleeding can occur and how much can it affect. Like in milliliters, okay, let's say you have a rib fracture. You can have as much internal bleeding as 125 milliliters. okay, which is not a crazy amount, versus radius and ulna fracture, okay, radius and ulna, okay, up here, you can have as much internal bleeding as 500 milliliters. And that's just the amount that your body can withstand in here. And the best way to identify the kind of internal like bleeding is through blood pressure. Okay, tib and fibula, okay, down in the shin, okay, that's up to 1,000 milliliters. Okay, femur, okay, can go up to 2,000 milliliters. Okay, which that's a liter, which 40% of all adult blood volume. Okay, which is enough to put you in hypovolemic shock and potentially kill you. Okay, so femur fractures are no joke. Okay, that's one of the strongest bones in your body. Okay, that's just the amount of all the blood that can accumulate within your thigh, based on all the exterior like fascia and tissue and all that other connective tissue. That's just how much it will allow. Now your pelvis, literally in the research, shows up as massive as the total amount. It starts out at minimal, about 1,000, and it goes up to massive. Because your pelvis is all pretty much in your gut. Okay, and if any kind of internal bleeding there, there's nothing that can really stop it besides lack of extra blood that can fill it. You don't have enough blood volume to fill up your pelvis area. Okay, so it's going to take all of it. So that internal bleeding is usually someone gets in a car accident or hit by a car, and they get up like, I feel okay, like my hip hurts a little bit, kind of a thing, and then like 5 minutes later they just pass out and die from that internal bleeding. Okay, so the best thing if direct pressure fails is to apply a tourniquet. Now tourniquets are really big, like way back in the day, like World War II, and then they kind of lost popularity just because of the potential effects of damaging the blood vessels and nerves. Okay, but and then they're coming back now with full force. A lot of research has shown that they're very beneficial, even for common injuries, especially they're really common with stuff like active shooter nowadays, to where you may be isolated for a little bit, and they're really recommending a lot of institutions and big companies carry tourniquets just in the event of said incident were to happen. Okay, and with all surgeries, they use tourniquets all the time. Okay, if you ever had like ACL surgery or whatever surgery to your arm or leg, they usually put a tourniquet on. Especially used properly, can really save your life and limb. Okay, so the purpose of the tourniquet is to occlude blood flow. So occlude is just to stop all blood flow. Okay, there's 3 tourniquets that are recommended. There's the CAT, there's the EMT, and then the soft one. Okay, they're roughly pretty close to one another. Okay, so here's the CAT and the soft. They're really almost identical. The CAT's probably one of the most common ones out there. So you want to occlude all blood flow, which if they're conscious, hurts like a lot. So hopefully we got the blood pressure already in this course, but if not, or if you've ever had blood pressure taken, which you usually have, which you can use a blood pressure cuff to occlude blood flow, but you're putting it on as tight as possible. And you're not letting it off. Okay. Videos here, I don't want to waste time on these videos. They will be in the module, okay, or here's a link here if you want to plug it in, okay, on some of the different tourniquet ways. The application is going to be proximal to the hemorrhage, okay. Hopefully someone can still holding direct pressure. They'll try and slow down a little bit. You can also put a second tourniquet on, okay, so let's say you put the first one on like super tight, okay, it should be past the pain of them saying stop, and then you keep turning it to slow down blood flow. Okay, because when you put it on, it should stop. Blood flow should stop. Let's say you got a bigger like thigh, for example. The first one's on, slows down a lot, but it's on pretty much all the way. Okay, put a second one on. Okay, maybe a little bit more distal or wherever you got room for it. Okay, you're not taking off the first one. Okay, if you put a tourniquet on, you don't take it off. Okay, no matter what. I don't care what they say. They threaten me. You don't take it off. You let ER take it off. Okay, but you can always put a second or a third on if you got it. Let's say um, theoretically, auto accident, they lose their leg, okay, at the ankle. Okay, you can put a tourniquet on at the thigh, really proximal, great. Okay, or you put it on below the knee. Okay, we'll say below the knee. Okay, that slows down like a lot. Okay, but you still need to stop the bleeding, so you're putting on another tourniquet on the thigh, or maybe a third for the amount of bleeding that they got because those muscles are so big. Okay, so tightness, you're putting again enough to block blood flow, fully occlude it. Okay, it's gonna hurt like hell if they're conscious. Okay, then with this on, you want to write down the time of application. Really, really important, the exact time. Okay, usually there's an area on it that you can write down on there. Don't even think about removing it. ER and OR are the people that will remove this. Okay, pain, if you put it on right, it's going to hurt. If it doesn't hurt, you need to go tighter. Okay, time, OR tourniquets, operating room, have been used safely for like 2.5 hours. Okay, so by all means, you can leave it on like a good amount of time. Okay, without nerve or muscle damage. Okay, because that's really the biggest thing they're really concerned about is damaging muscle from like hypoxia during like surgeries. So that's why a lot of surgeries they want to do as quickly as possible to prevent that kind of hypoxia from affecting those like distal extremities. All right, last few things, wound debridement, okay, or cleaning. Okay, so this is removing the unwanted items like grass, dirt, bacteria, whatever got into that open wound. Okay, this really prevents infection. Okay, so you're going to lose either saline or tap water. Okay, you want a pretty good amount of pressure, 4 to 15 psi pressure, which is, I think, coming out of the hose can get like 7 to 10. Okay, so that's good pressure is what you want. Just try and flush it out. And you're going to use a lot of water if you can. Okay, by all means, like make a mess. Okay, and that is probably the best thing. That and soap. You don't want to use peroxide, alcohol, betadine, iodine, nothing else. Okay, what that has shown is if you use any of those, because like alcohol and hydrogen peroxide are really big, is for one, they're not supposed to be put in cuts. It slows down healing because you're killing any bacteria, yes, you're also killing everything in that wound. All the good stuff, the erythrocytes, the blood cells, anything. You're killing all that, which is now you're making a good environment for any other new bacteria to come into there and grow. Okay, so soap and water is the best thing to do, especially if you got an injury. Let me go back a little bit. Okay, this one, irrigate it. Okay, same, irrigate. Irrigate. Okay, irrigate. Really gets all that stuff out of there. You don't have to like drench it in like any kind of like peroxide or anything, which one's going to burn like crazy. Okay, which is not what you want. Okay. Okay, so use for any of this. Okay, soap and water. Here's some other videos you can watch. There also should be in Canvas, or if you download the PowerPoint, you can watch them on your own. All right, so wound cleaning. Okay, also or debridement. Okay, so we can get a little more in depth on some of the things used to remove kind of dead or necrotic tissue or infected tissue. Okay, so not all wounds need to be pretty much debrided. It's irrigated. It should be debrided. Okay, so there's multiple types of debridement. Okay, there's surgical, which is them just going and cutting it out. Okay, same with sharp. There's chemical debridement, so use different chemicals to kind of get rid of that whatever dead necrotic tissue. We're going to talk about what to moisten, what to dry. Hydrotherapy. There's autolytic. A number of different types, and there's more so than this. So it really depends on the type of wound, the type of debris that's in there, the level of training of the personnel, experience, cost, and time. This really is a big factor for all of these. So with the dry debridement, okay, is applying a wet wound with a dry dressing. Okay, is what normally. Okay, so we're not talking about controlling blood anymore. It doesn't know this. So bleeding is for the most part stopped. Okay, so this is an old school method. Okay, that a lot of people still do this day and age, is just taking that wet wound, okay, which is normally wet, okay, and putting a dry dressing on. Okay, so you actually increase the chance of infection, increase healing times, and then once you remove that kind of dry gauze, because all this kind of wet wound is now stuck to that dry dressing, okay, you're removing all that necrotic and healthy tissue. Okay, so this is the one thing we don't want to do anymore. Okay, and it's as easy as doing a wet to wet, which I have it in here. I got too many. Some other ones. The wet to wet debridement is just wetting the gauze pad. That's it. Just wet that gauze pad. You don't have doesn't have to be soaking, but just get it get it wet, wring it out lightly, and just put it on the wound and kind of wrap it up normally. Okay. That way, any of the kind of necrotic tissue, okay, will stick to that. So when you take it off and change that bandage, hopefully every day, you're just taking off all the dead areas and leaving all the fresh and healthy. Okay. So I'm not going to play these just because it doesn't like sync as I do this over the recording. It just doesn't never plays well. But make sure you watch on like some of these wound cares, and here's like the wet to moist. Here's some different mess on debridement and so forth. And with that ends our TED Talk.